Spay neuter myths busted. With us today is Dr. Jeff Adams, the medical director for C-SNiP and All About Animals Rescue.
Dr. Adams, thank you so much for taking the time to chat with us. Our team gathered quite a list of spay-neuter myths, so let's dive in. As the medical director at C-SNiP and All About Animals Rescue, you've sterilized thousands of animals. So I want to start with some medical reasons why pet owners choose not to spay or neuter their pets. This is a long list, so here we go. May cause incontinence. Significant increase in the risk of osteosarcoma, bone cancer, in dogs spayed before 1 year of age. An increase in the risk of splenic hemangiosarcoma and cardiac hemangiosarcoma, a tripled risk of hypothyroidism, persistent and recurring urinary tract infections, tumors, or cancers, an increased risk of recessed vulva, vaginal dermatitis, and vaginitis, especially in female dogs spayed before puberty, an increased risk of adverse reactions to vaccinations, an increase in progressive geriatric cognitive impairment or canine dementia, and a quadrupled risk of prostate cancer. Is there any truth to these claims?
This is a very complicated area, which is why there's a lot of confusion. The majority of what you hear are myths. It basically comes down to the fact that the studies that these concerns originated from are studies that were done. First of all, they were what was called retrospective studies, where we go back and collect data that has already happened. In that case, we can't control that data for certain breeds and certain ages and certain weights and this kind of thing. So it is what it is. So to draw conclusions from that data that apply to the whole general population is very difficult to do, yet that's what has been done in some of these articles. So kind of lumping all those diseases together, it's if you can imagine that you take you're comparing a Chihuahua to a Mastiff, other than all the components are the same, they're very different in many ways. So if you're not factoring that into this kind of research, you're not going to get accurate data that apply to all cases. So in most of those cases, the studies were either too small a group, they were specific breeds, they could be data collected from referral hospitals, or college clinics, that don't represent necessarily the general population. If you're looking at cranial cruciate ligament rupture, for example, you would want to know, in addition to whether the dog was spayed early or spayed late, you'd pretty much need to know what's the breed of the dog, B, what is the weight of the dog? Were these dogs overweight? Were these dogs underweight? None of this is included in any of these studies. So to kind of wrap it up, the latest study that was done using mixed breed dogs with and they divided them by weights. So they looked at them in different weight ranges. And when they did that, this was particularly looking at the tumors that you mentioned. Mm-hmm. When they did that, they saw no difference. So when you took the genetics out of it and you took the the environment out of it. Were they, were they running the fields, or were they living in an apartment, and how does that contribute to orthopedic problems? Um, all of these things, when you take those things out of it, and then you look at early versus later spay neuter, it didn't make any difference to those. But when you let all those other factors in there, you were getting all sorts of data that would tend to indicate that there was a possibility. So I think in veterinary medicine, what we need to do is we need to look at these studies as this is how we get the right question to ask. And then once we get that question, then we can do further studies to see whether that actually, what the answer to that question is. So these studies didn't say, yes, this causes this disease, this early spay neuter causes this disease. What this says is, I wonder if it does. It looks like there's a possibility it does, so let's figure that out. Let's do the correct study now to see whether that actually does that. Let's take all of these other, what we call confounding factors. Let's take as many of those out as we can and just look at the time of spay neuter and this disease and make everything else in between equal. And until that's done, these studies are meaningless in themselves, other than they raise a question. But they should never be proposed as an answer to a question. So if we're making recommendations, or we're basing our policies on those studies, that's a mistake, because it could be the exact opposite. They could be totally wrong the other way. We don't know it until we do more research in that area, which will take years to do. So as it sits right now, there's nothing about early spay neuter that would preclude us from using it as an effective tool in population control of the pet population. So there really would be no reason to change anything we're doing at this point.
Here is another medical related myth with a follow-up. Spay neuter is unhealthy for pets. And as you already alluded to, along those same lines, altering puppies and kittens when they are too young or too old will cause health issues. Go ahead and take it.
If we're talking about unhealthy because it's setting them up for future issues, we've just talked about that. Unhealthy from the standpoint of risky surgeries, we have all the information we need for that too. I mean, the numbers of spays and neuters that are being done across this country on young animals, younger than 6-month-old, which is kind of the traditional veterinary time to do that. The number of animals that we do prior to that time certainly is a large enough number of various species or various breeds to tell us that we don't have an increased risk from the actual surgical procedure itself.
This one really drives me bonkers. A female pet should have at least one litter before being spayed.
There's, once again, absolutely no medical reason for that. And the studies we do know from the incidence of mammary gland tumors tells us that the likelihood of a dog getting mammary gland tumors later on in life increases fairly significantly between spaying before the first heat, spaying after the first heat, and spaying after the second heat. So with each of those jumps, the increased likelihood goes up, and it makes perfect medical sense. Each one of those heats stimulates the mammary glands. Prior to the first heat, those mammary glands in the females are no more developed than they are in the male. So the incidence is really low. But as you stimulate them through those heat periods, you're actually stimulating those cells that, if overstimulated, could turn into tumor cells. So it makes perfect sense. And that data we do know, we do see that trend being something that has stood the challenge of further studies and has been something that's been supported through species and through different sizes and ages of animals.
How about sterilization causes weight gain?
Once again, that's kind of a decided issue, that it is not the sterilization that causes the weight gain. As animals get older, their metabolism changes and they require different feeding, different levels of exercise, just like in people. So same issue. So it was always thought that was, once again, was the cause. But just because there's a correlation doesn't mean there's a cause. And so, yes, at a certain age, the animal gained weight, but that doesn't mean that it was the spay that did it. So, it's the old, just because B follows A doesn't mean that A caused B. So
Right.
that's the bottom line on the weight gain. We all know that now, that is a total busted myth.
I would imagine also genetic predisposition in certain breeds and certain size dogs and all of that factors
Absolutely. We see plenty of severely overweight, intact dogs.
So along that with, overweight, a pregnant animal cannot be spayed.
Once again, there's no reason for that. It is a surgery that the dog tolerates fine. It does take a little bit more experience as the surgeon, but as long as the surgeon is experienced and the procedure is sound, those surgeries shouldn't have any different outcome than any other spay and neuter. There are, like I said, there are some potential issues you can run into depending on particularly those animals that are term pregnant, but they're avoidable as long as you're anticipating them and watching for them.
How do you respond to pet owners who are concerned that sterilization surgery is painful?
It isn't anymore. I can't defend our profession 20 or 30 years ago, but as it stands right now, the pain medication that the dogs and cats are getting is very effective at managing pain. Just like in human medicine, same type of kind of multimodal combination of anti-inflammatories and straight up pain medication. Most of them, the opioid pain medications, do a very effective job at managing the pain. And like I said, if you think back to anybody who's had any outpatient surgery, it's not pain-free, but it's very well managed. And I think that in animals, it's actually a little bit better managed than it is in humans, because we aren't worried about sending them with adequate pain medication.
Right. Well, and correct me if I'm wrong, because I believe many forward-thinking veterinary spay neuter veterinarians are also working with long-term pain, an injection at the time of the surgery, so that you're not having to give them oral meds and fight through that, and you get to the point where the edge is taken off after 72 hours or some such.
Yeah, we have a lot of different options at our disposal to make sure that we've got that covered. We're very much aware of the potential for pain. We're timing the administration of our pain medication so that the pain medication is on board at the time of surgery. We're using local anesthetics in addition to general anesthetics to try to minimize the amount of pain postoperatively. So we're doing it all. And so the concern about this being a painful procedure, and certainly that the level of pain is something that would make somebody not consider getting the surgery done, there's no need for that. We have very effective pain medications at our disposal.
Now let's turn to a pet's personality and behavior, because we all know that that's a big thing for owners as well. Will sterilization change a pet's personality?
There's been a lot of debate on that in that regard. as we all know, anybody who's been around litters of puppies, personalities are pretty much in place at birth or
Right.
shortly thereafter. So to change that takes something pretty dramatic to happen. Removing the hormones, estrogen and testosterone, um, isn't really something that we would expect to have a major effect on behavior. So in most cases, behavioral changes in dogs are not attributed to spays and neuters, and most behaviorists will agree with that. There are a few that are like, well, we do see a little bit difference in specific uses in dogs. There's a debate on whether it makes, leaving them intact makes them more trainable. Some people say absolutely not. It makes them less trainable. We all know the behaviors that come with those hormones can be disruptive. But from the standpoint of just their basic core personality, I don't think that's related to those hormones at all. And the studies that have been done on it, asking owners, like I said, once again, a tricky business, because you ask an owner whether behavior has changed on a bloodhound and behavior has changed on a Chihuahua. They're completely two different wired animals. So that makes it really hard to get an idea. But in general, we don't see a personality change for the worse that would preclude spay and neuter to preserve a certain personality. Although it's really easy when a dog turns out to have a bad personality to blame it on something, So,
Right.
but in most cases, if you knew the litter, you'd probably be able to figure out that was not going to be a good deal in the first place. Yeah.
Exactly. And having had a few litters ourselves, I can attest to that. They're all individuals. We need to keep that in mind. Does neutering a male dog or cat diminish their masculinity or make them less of a man? And yes, we do hear this a lot. We hear this a lot.
My opinion is no. And from most of the trainers that work with the dogs that they need to be, whatever manly means, whatever definition you want to put with that, or whatever you want to put with masculine, those things don't go away. What goes away are those behaviors that are mainly based on reproductive urges, which are not helpful in any situation, in both in training and both in the ability to get them oriented to crowds and oriented to other animals and those types of things. They're not helpful. So most trainers will agree that there's no advantage to leaving them intact, other than some very, very specific uses.
Now, let me ask you this one. Are dogs and cats less affectionate or even, let's say, less nurturing after sterilization, especially if they've already had a litter?
Uh,
I threw you for a loop there. I know that was kind
well,
of like,
no,
that's subjective.
yes, that's fine. Overall, no. I think that is, once again, goes back to more of that core personality than any thing they're getting from a reproductive hormone. The hormone in female dogs, those hormones are kind of oscillating at all times. So you're not going to get a consistent behavior due to the hormone, because their hormones are shifting all over the place. The male hormones are more consistent in levels, but once again, most of the hormone related male behaviors certainly wouldn't be considered as affectionate and nurturing particularly to humans, but in general. I mean, because that's their drive.
Now, you touched on this already about behavior problems, obviously, earlier. Will the spay neuter itself lead to behavioral problems? For example, make a male dog more protective? Or is that a myth as well?
No, I think that goes back to a lot of things. And once again, what I'm looking at is we've got hormones that dominate in intact animals, and we have hormones that dominate in altered animals. And so I'm looking at those hormones. None of them would really be as effective at changing their protectiveness than how they were raised, how they were socialized. Environmental factors would have more to do with that, and core personality. So a dog that has never been off the farm and has only seen people every once in a while, that dog is likely to be protective, intact or not. That wouldn't really matter. A dog that is well socialized is probably not going to be as protective, unless their core personality or their breed, genetically they're coded for that. So I don't think the spay neuter, the existence or absence of any of those hormones we're talking about, would really affect that. And I don't think anybody would expect it to, other than, like I said, that I think that once again, if B follows A doesn't mean A causes B.
Let's cover some general myths. We'll start with, what do you tell people who think the cost is too high?
We try to contain, I work in spay neuter, high volume, spay neuter, low cost. We've been able to minimize the cost, but there's still a cost. And it's the same cost issues that everybody has. I mean, the medications are expensive. They're not, they never get cheaper. We never suddenly have them drop in price. So it's an ongoing issue. So the cost is the cost, but it has been minimized in those cases. I do think in some cases in the private veterinary practice world, it can get pretty extreme.
Yes.
And what happens is this is something that human medicine has struggled with over the years. Insurance companies have helped, because insurance companies have said, we're not paying for this and we're not paying for this, because they don't help. They don't make the surgery safer. They don't help anything. But in veterinary medicine, we don't have anybody necessarily doing that. And the more things you can do in a procedure, the higher the costs get. Excuse me again. So we do have a cost issue with it. And until we kind of change the way we think about this in general practice, which would change kind of the whole business model, it's pretty much going to rely on those of us who are looking to offer it at a more accessible price, to kind of carry that torch and keep that availability. But that also means that the resource is limited. But if somebody says it's too expensive, I say, first of all, find a high volume clinic to get your best price. And if it's still too expensive, talk to them, because most high volume clinics have the resources to offer some subsidy to help cover the costs in order to get the job done. But unfortunately, the cost that those clinics charge is probably the lowest it can be, because there are no frills. I mean, everything's safe, everything's top quality, top notch, but there's no other way to cut that price down.
Yeah, and thank you for pointing out the disparity because working in sheltering, we are always advising people how to look for a better price for the same product. And and I think until the higher volume clinics become a little more mainstream, and thank you, by the way, because 10 years ago, it was almost unheard of. Now, there is an understanding and a reputation out there that the higher volume clinics are doing the same job and they're doing it at a very reasonable cost. So thank you for that. I appreciate your work in the field for sure. That helps us every single day. So here is a very actually a very hot topic. How do you feel about shelters and rescues who adopt out unaltered animals?
In a perfect world, they would all be spayed and neutered. But I do realize that even with, as you said, with this becoming a more accepted part of the veterinary community, um, these high volume, lower cost clinics becoming more mainstream and more accessible, we still don't have the resources to handle all of the public demand and all of the demand that the shelters and rescues present, which is it's just not there. So in some of those cases, knowing that voucher type programs and that kind of thing aren't optimal, in reality, I think in some cases they have to exist. We would like it if we could get it all done, and we do our best to try. But I know from the experience we've had, we just the resources just aren't there to cover everybody. So I think as the only thing I would say is it would. I think it's important to still try our best. So to just go straight to that and just say we're just not going to worry about that anymore. We know from the voucher programs we work with, they're tough to enforce. The compliance is low. You don't get everybody, so we're not doing the job we could do with it. But in some cases, if a well-run voucher program that's kept close track of and that kind of thing can work, but it takes a lot of work. But in a situation where you're trying to move animals through a shelter or a rescue and that resource isn't there for you, you can't stop everything and wait until you can get it done. I mean, realistically, you just can't do that. And we sometimes can't, there's just so much we can do too. We're all working under limited resources also. So, I do realize that in some cases it's necessary, but once again, it's necessary and it can be successful if well run. It can be very unsuccessful if not well run.
Right, and you brought up resources. That's the biggest thing, I think, in most cases. The last couple of years under the pandemic, the high volume clinics have been slammed, shelters and rescues, everybody is short staffed.
Yep.
And so having to place some and the issue with having the resources to run a high quality voucher program is difficult. So I'm hoping that we have all taken this as an opportunity to learn how to build a better program moving into the future as things open back up, because that would help us all. I'm going to go ahead and piggyback on that last question because this is a topic that, well, I won't give you my personal input on this. I'll ask you, what are your thoughts on the relatively new concept that shelters and rescues should breed dogs to maintain a puppy supply?
I don't. I can understand a few motives behind it, and I'm not that happy with any of them. I also don't feel that shelters and rescues are necessarily the best for that purpose. That's not really in their wheelhouse. as far as what we're producing. What puppies would you produce? What would you breed to what? How would you go about that? So I think there's a lot of concern there. I mean, I think the question of is where do the puppies of the future come from? If we're successful in what we're doing and we spay and neuter everything, what then? I think that's utopian. And the realization is that that's never going to happen. There'll always be people out there with intact dogs that are having puppies, and there'll always be sheltering, there's always be rescuing, there's always be that kind of thing. And I think the opportunity to move animals around from overpopulated areas to areas that have room for dogs is good if well run, if well done. Um, but I think at this stage of the game, I'm a little concerned that the reason for doing it isn't purely we don't have any animals, because if you don't have any, somebody does, likely. So it's not, it's not that. So I like I said, I don't know that I thoroughly understand the motive behind it, but I do understand that it's a thought of, where, as we get more successful with this, finding a puppy could get difficult in some areas, but I do think that there are better ways to supply puppies than that.
Thank you for again wording that more diplomatically than I might have. That's very good. I'm going to push a couple of questions together because I think they're relevant together. I've heard pet owners say that their pet is so special, they want a puppy or kitten just like them. And some parents want their children to experience the miracle of birth. They also, at this point, then are dealing potentially with the rest of the litter, and they think they can find homes for them. What do you think?
Um, I've known, I've been a veterinarian for 40 plus years, so I've known a lot of people who've done that. And one thing I can tell you is, you can have a litter of puppies, and none of them can be like the mother. So you don't necessarily replace your dog with a litter of puppies. First of all, you're actually not going to, because the father contributed some in there too. So
Right.
so that, as much as you'd like to replace your dog, you're just not going to do it. And the we'll find homes for the rest of the puppies is not generally the way it works. You may find homes for a few, but you don't know how many puppies you're going to have.
Yeah.
So that part of it requires some discussion, but it's not going to help. And some of, what if she has difficulty having the puppies? What if she has issues following having the puppies? What are you willing to risk her life for this, for the possibility of getting a puppy? Number one. Number two, what does that litter or that litter and subsequent litter do for her lifespan? Are you trying to replace the puppy, but you're decreasing the lifespan of the dog you're trying to replace? Doesn't make any sense. So from that standpoint, that doesn't hold any water. In 2022, if you want your kids to experience the miracle of birth, turn on the TV. I could flip through the channels. You'll find some vet show somewhere where something's having something. So
Exactly.
once again, I maybe back in the day, but I think we're past that miracle of birth thing.
Exactly. And coming from the time when it was, indoor outdoor cats, and your cat came home and the next thing you know, at 4 a.m, you had a litter under the bed. You're going to wake those kids up at 3 or 4 to, what if they're not home when it happens? You've missed it yet. It's not worth trying again and again.
No, I don't think that. Once again, doesn't quite cut it for a reason to not get them spayed. Or it doesn't balance out against the risk benefit ratio doesn't work out well in that regard, because like I said, then that dog down the road ends up with mammary gland tumors,
Right.
so what did you teach the children then? So yeah, so like I said, the benefit of that doesn't in any way match up to the risk you're taking.
I think we have time for one more quick one before we wrap up this part of our presentation. So owners of purebred pets who might be tempted to breed the pet separate from a breeding stock, just their own pet, to continue the line. And what's wrong with this? Why is this a myth? And what's wrong with this reasoning?
I don't think people understand what exactly goes into creating some of these purebred lines of dogs. And if you're buying a dog or getting a dog from a serious breeder, they are breeding lines of dog. It's a very calculated process. Each generation should be improving the past generation is the key. When you take your dog and you look up an ad in the paper and take it over and breed it to another purebred dog and have puppies, you're not doing that. You're actually producing an inferior dog to what you had. So in that situation, that once again, you're not accomplishing what you're trying to accomplish. And so, and one thing that I've also found out after 40 years is that particularly people who raise a litter of puppies and sell purebred puppies, you own that puppy for the rest of your life, whether you thought you sold it or not. If 4 years from now that dog comes up with some orthopedic problem or some heart problem, guess whose phone's going to ring?
Exactly.
So you gotta think about that. But like I said, I don't have any animosity towards somebody who's breeding dogs purposefully with a goal. But that's what it is. These aren't people that are just out breeding one dog to another dog and turning out puppies. That's a puppy mill. These are people who actually are trying to improve the breed. They are trying to get away from some of the genetic issues, some of the genetic nightmares we've gotten ourselves into with them, are trying to break past that, and that's fine. But that's not the average pet owner. The average pet owner doesn't need to be in the breeding business, because they will find out that whatever they made on that litter of puppies, it'll be not a good return on their emotional investment when it's all said and done.
And as again, working in the sheltering world, you get those phone calls even if you just placed that animal 4 years ago. So
Yep.
I absolutely understand what you're saying about had you bred them yourself. Yes.
I want to thank you all again for joining us. If you know someone who loves pets and is not yet a member, please invite them to join the Michigan Pet Alliance to speak for those who cannot speak for themselves.